An outbreak of the Ebola virus has been linked to more than 130 deaths in Congo and Uganda since it was detected last week, and it's causing concern for authorities on this side of the world as well. Yesterday, as you probably heard, a jet heading to Detroit from Paris was diverted to Montreal after concerns were raised about one of the passengers. So that raises a lot of questions. Sarah Galashan is here to provide some of the answers. What happened?
Well, yeah, so this was Air France 378. It was leaving Paris, destination Detroit, supposed to land local time around 6:30 p.m. But according to a passenger on board who's speaking to American news outlets, at around 4 hours to that landing time, the captain came on the intercom and said that they were being diverted to Montreal with not a lot of explanation at first. The crew on board started putting on face masks. Eventually, the captain came back on and explained that this wasn't a technical issue to do with the plane, that the plane was very safe. Air France has confirmed that the reason was because the U.S. had denied entry into the United States because there was a Congolese passenger on board who the airline says had been boarded in error. And this is in keeping with Monday's announcement from the United States that there was a new policy in place as of Monday prohibiting non-U.S. residents who had traveled in the region of Congo, Uganda, and South Sudan, and Congo being where this outbreak is really central to. If they had traveled in that area or were from that area in the last 21 days, they would not be allowed to enter the United States. So enter Canada, where there is no such policy in place. The plane was accepted to land in Montreal, landed just after 8 p.m. That passenger gets off the plane and is met by a quarantine officer, and they were assessed from Health Canada or from the Public Health Agency. CBC has a statement saying that passenger was, quote, asymptomatic. So that passenger got on another plane, went back to Paris. That Air France flight, though, that Air France plane with all the other passengers then was able to carry on. And Ian, they landed in Detroit later that night.
So a lot of confusion, I'm sure a lot of concern among the passengers, a huge cost to divert a plane to land in Montreal that's bound for Detroit. Are we going to run into this situation again?
I mean, so consider the numbers. I mean, you can't say for sure, right? But at this point, the WHO is confirming that there is this outbreak in Congo primarily, as well a number of cases in Uganda, but a small number at this point. And that's as of last Friday. So we are, not quite a week, but almost a week into this. And right now, the DRC Health Ministry is saying that there's 670 suspected cases and at least 160 suspected deaths. So concern is growing globally about this. And the policies in the United States are starting to perhaps reflect that, because not only is there that policy that came into place on Monday in the United States, but additionally today, it has been added that if there are American citizens who have traveled in this region within the last 21 days, that they will only be allowed to enter or re-enter the United States through a single airport, and that is in Washington. That is Dulles Airport. And passengers, once they arrive, there'll be enhanced screening there. Their temperatures will be taken, their contact information, their travel history, and where they plan to be traveling will also be noted. This policy comes, at the same time that I will point out the U.S. Center for Disease Control is saying that there's no confirmed or suspected cases of Ebola in the United States, and the risk to the American public, Ian, is considered to be low.
Okay, Sarah, thank you very much. So a lot of people are wondering about the American policy, the Canadian policy. Let's talk to someone who has seen the impacts of Ebola firsthand and also knows a lot about it. Dr. Allison McGeer is an infectious disease specialist who was among many Canadian doctors who traveled to West Africa in 2014 to help the World Health Organization combat the outbreak there. Dr. McGeer, thank you very much for speaking with us. First of all, this U.S. decision to divert the plane to Canada because an asymptomatic passenger came from an area where there is this Ebola outbreak. Is that an overreaction by the Americans, do you think?
Well, I think what you can say is that there's no other country that's doing that. And so that's not because other countries haven't thought about it. It's because other countries have thought about it and decided that it's not a useful thing to do. We have no idea where this man came from in the DRC, but it's a little bit like saying, well, if there's an outbreak in Ontario and you get on the plane from Vancouver, do we really need to worry about that, right? So I think everybody's hoping that we'll be less restrictive than the Americans currently are.
So we have the Americans saying that plane couldn't land in Detroit with that passenger on board. We have the restrictions going forward if American citizens from that region want to come back home. We just heard our reporter Sarah Galashan talk about that. So how concerned, Dr. McGeer, should we be about this plane touching down in Montreal and that asymptomatic passenger, I keep saying asymptomatic, but about that passenger deplaning at least briefly in Montreal? How concerned should we be?
Oh, not the least. That's what we have quarantine officers for. And it is very important to remember that Ebola is not transmitted from person to person until somebody is symptomatic. So if he's well, and we don't know anything else about him, it's really unlikely that he was traveling from an area where there is an outbreak. DRC is a very large country. So if the quarantine officer made a decision that there's not a risk, there's not a risk. None of us need to even think twice about, except to worry about how much plane fuel got used and how much it costs to divert the whole plane.
That 2014 Ebola outbreak in Africa was terrifying, thinking back to the coverage of it. And you are among the doctors who went there. You traveled to Liberia, as I understand it, several times to help combat the outbreak, which, is incredible service. How do you think today's outbreak in East Africa compares?
I think it's really hard to tell. At the moment it's much smaller, and even in the previous outbreak of Ebola Zaire in this area is still substantially smaller than the outbreak in West Africa. So I think we have every reason to hope that despite the really challenging conditions that exist, that this outbreak will still not be the largest outbreak, and hopefully not even the second largest outbreak. But it is it's going to be an outbreak that goes on for months, probably. The last outbreak in this area took nearly 18 months to bring under control. It is a lot of people are going to be ill and die in this. It's going to take a huge amount of work, and I think we, with the US CDC and USAID and the WHO all having been substantially weakened in the last couple of years, it just makes everything even more challenging than it already is.
Yeah, so let me finish with, go ahead.
I was going to say, not a concern for us, but, an enormous burden on a substantial area of Africa.
Yeah, so that's exactly where I wanted to finish with kind of two parts to a question. So first of all, in terms of concerns that Canadians may have about that Ebola outbreak leading to infections here, how, as an infectious disease specialist, how concerned are you about that?
Not at all, for two reasons. And it's maybe not quite not at all. But firstly, this is not an area where there's a lot of travel to Canada. 2014 outbreak was a much larger outbreak. We still had nobody who traveled to Canada. So the chances that somebody from the area who's been exposed will be on a plane and come to Canada and bring Ebola to Canada are really small, and we are prepared for it. We've set things up, we've practiced for it, we're going to be thinking about how to protect ourselves, and we're working with colleagues in Africa to prevent people from leaving Africa who are infected as well, right? They're doing the contact tracing that gets in touch with people. So it's not impossible that somebody will come. What is impossible is that there will be a substantial outbreak in Canada. I can't promise that there might not be transmission to a close contact because something goes wrong, but it's not going to be an outbreak.
One last thing, and we have less than a minute left, but for compassionate Canadians who care about what's happening in other places in the world, is there anything we can do? What should we try to do to help Africa deal with this?
So I think at the moment the answer is send money, okay? Because there are Médecins Sans Frontières, right? There's any number of healthcare organizations that are there. There's people from UNICEF supporting families. There are lots of people who are going to need a lot of resources to deal with this. And the most effective thing all of us can do is to donate money to those organizations.
All right. And again, amazing that you and many of your colleagues headed to Africa in 2014 to help combat the outbreak then. Dr. Allison McGeer, an infectious disease specialist in Toronto, thank you.
Night, Ian.